Hi, my name is Coreg, I'm a pharmacist. For the next few minutes, I'll be reviewing the medication Carvedilol, better known by its brand name Coreg. I'll cover what it is, how it works, how to take it, side effects, and important safety tips and best practices that I believe you should be aware of. Now, as a quick reminder, this video is for educational purposes only. It is not personalized medical advice, so please do not stop, or make any changes to your medication regimen without first consulting your doctor. So let's start with the basics. What is Carvedilol? Well, Carvedilol is the generic name, and its brand names are Coreg and Coreg CR, which stands for controlled release. Now, Carvedilol belongs to a class of medications we call beta blockers. Specifically, it's a non-selective beta blocker with alpha blocking activity. Now, I'll explain what that means in just a moment. So, Carvedilol is approved for the management of high blood pressure or hypertension, as we normally call it. It's also approved in the management of heart failure with a reduced ejection fraction and something we call left ventricular dysfunction following a heart attack. Now let's talk about how Carvedilol works. Now, to understand how Carvedilol works, we need to talk about your nervous system. Now, your body has what is called the sympathetic nervous system. Think of it as your body's fight or flight response. When the system is activated, it releases chemicals like adrenaline, which make your heart beat faster and harder and causes your blood vessels to tighten up. Now, while this response is great in emergencies, when it's constantly activated, like in people with high blood pressure or heart failure, it puts extra strain on the heart and blood vessels. Carvedilol works by blocking the receptors that respond to these stress chemicals. Specifically, it blocks beta receptors in your heart, which slows down your heart rate and reduces how hard your heart has to work. Now, an additional feature that Carvedilol possesses that other beta blockers, with the exception of labetalol, do not have is its ability to also block what we call alpha receptors in your blood vessels. Now, why is this important? Well, this is important because blocking alpha receptors in your blood vessels help them to relax and widen. So, in essence, Carvedilol has a twofold action. Number one, it slows down your heart rate and reduces the force of each heartbeat. And then number two, it causes your blood vessels to relax and widen, which lowers blood pressure. So this combined effect reduces the workload on your heart, making it more efficient at pumping blood. Now let's talk about how to take Carvedilol. So Carvedilol comes as oral tablets in various strengths ranging from 3.125 milligrams, 6.25 milligrams, 12.5 milligrams, and 25 milligrams. Now, there are also extended release versions available. So your doctor would typically start you on a very low dose, typically 3.125 milligrams twice a day, and gradually increase it over several weeks if needed. Now, this slow titration is important because Carvedilol initially can lower your blood pressure quite a bit. So the titration allows your body to kind of get adjusted and used to the medication before you reach your therapeutic dose. The maximum dose varies depending on your condition and weight, but can be as high as 25 milligrams twice daily for some people. Now, Carvedilol should be taken with food ideally to help reduce the risk of dizziness and also to improve absorption. Try to take it at the same time every day and so as to maintain consistent levels in your system. Now let's talk about some important safety information and best practices you need to know about Carvedilol. First and foremost, never stop Carvedilol suddenly. Your body becomes accustomed to the medication, and stopping abruptly can cause a dangerous rebound effect where your blood pressure spikes or you could even have a heart attack. If you need to stop, your doctor will gradually reduce your dose over time. Now, because Carvedilol lowers blood pressure and heart rate, you may experience dizziness, especially when you first start taking it or when your dose is increased. Best practice is to avoid getting up too fast from a sitting or a lying position. So for example, sit on the edge of the bed, take your time, make sure you're steady just to prevent a fall. If you have diabetes, be aware that Carvedilol can mask some of the warning signs of low blood sugar, particularly a fast heart rate. So monitor your blood sugar more carefully and watch for other signs like sweating or shakiness. If you have asthma or severe lung disease, Carvedilol may not be right for you as it can potentially worsen breathing problems. Now, this is not an absolute contraindication, and therefore it's always best practice to discuss your respiratory conditions with your doctor so you guys can be on the same page. And also, as much as possible, avoid alcohol while taking Carvedilol, especially within 2 hours or so of the extended release tablets or capsules, as this can lower your blood pressure and increase the side effects. Now, talking about side effects, let's review some common side effects. Now, most of the side effects are related to how the medication works and generally improve as your body adjusts. So there have been reports of dizziness or lightheadedness, especially when standing up. I already tackled that. Fatigue or feeling tired. This often improves after a few weeks. There have been reports of diarrhea, reports of a slow heart rate, low blood pressure. I mean, I know it's used to lower your blood pressure, but sometimes the blood pressure may dip too low. Reports of nausea, headache, weight gain. Now, weight gain, this can be concerning in heart failure patients. So monitor your weight daily if instructed. Now, with that said, weight gain is a general side effect of beta blockers. And among the beta blockers, Carvedilol is actually less likely to cause weight gain compared to some of the older beta blockers like metoprolol. But it's still worthwhile keeping an eye on your weight when you start taking this medication. Now, let's talk about some potential serious side effects. So while serious side effects are generally uncommon, obviously it's crucial to know what to watch for. So the first one is worsening heart failure symptoms, which can occasionally happen when you start Carvedilol, particularly during the first few weeks. So contact your doctor immediately if you experience increased shortness of breath, sudden weight gain, which is more than 3 pounds in a day or about 5 pounds in a week, or swelling in your legs, ankles, or feet. Severe drops in blood pressure can also cause fainting. If you faint or feel like you're going to faint, contact your doctor immediately. There are also reports of severe allergic reactions. These are rare, but they are possible. So seek emergency medical attention if you experience any rash, hives, swelling of the face, the tongue, or the throat, or any kind of trouble breathing. That is, those are signs to be talking to your doctor. So Carvedilol is often called a life-extending medication for people with heart failure because studies have shown that it can significantly improve survival rates. While it may take some time for your body to adjust to the medication, the long-term benefits for your heart can be very substantial. I sincerely hope you found some value in this breakdown of Carvedilol. If you did, please give it a thumbs up, stay blessed, and I'll catch you in the next video. Thank you.